Fatty liver disease affects millions of people worldwide, and what makes it especially concerning is that most people who have it do not even know it. It often develops quietly, without pain or obvious symptoms, while slowly changing how the liver functions. This raises an important and very reasonable question. Can food actually help reverse fatty liver disease? Not through miracle claims or overnight fixes, but through measurable changes supported by scientific research. Instead of promises, what matters here is evidence, and when we look closely at what studies show, diet appears to play a far more powerful role in liver health than many people realize. Fatty liver disease occurs when excess fat accumulates inside liver cells. Under normal conditions, the liver contains only a small amount of fat, but when that fat exceeds a certain threshold, liver function begins to change. There are two main forms of fatty liver disease. One is alcoholic fatty liver disease, which is directly linked to heavy alcohol intake. The other, far more common today, is non-alcoholic fatty liver disease, often abbreviated as NAFLD. This form occurs in people who drink little or no alcohol and is strongly associated with modern lifestyle patterns. NAFLD is now one of the most common liver conditions globally, closely linked to insulin resistance, excess calorie intake, sedentary behavior, and poor diet quality. In many cases, it develops alongside conditions like obesity, type 2 diabetes, and metabolic syndrome. What makes non-alcoholic fatty liver disease so widespread today is the way modern diets interact with human metabolism. Highly processed foods, refined carbohydrates, sugary beverages, and excess calories overwhelm the liver's ability to manage energy efficiently. Insulin resistance plays a central role in this process. When cells stop responding effectively to insulin, glucose remains in the bloodstream. To manage this excess glucose, the liver converts it into fat. Over time, this fat accumulates inside liver cells. The liver is uniquely affected because it acts as a central hub for processing sugars, fats, and toxins. Unlike many other organs, it is directly exposed to nutrients absorbed from the digestive tract, making it especially sensitive to dietary patterns. Food matters more than we often think because it directly influences the metabolic signals that determine whether the liver stores fat or burns it. Excess intake of added sugars, particularly fructose from sweetened beverages and processed foods, places a unique burden on the liver. Fructose is largely metabolized in the liver, where it can be rapidly converted into fat. Refined carbohydrates, which cause sharp spikes in blood sugar, further worsen insulin resistance. Saturated fats, especially when combined with excess calories, can increase liver fat and inflammation. Research indicates that it is not just how much we eat, but what we eat that shapes liver health at a cellular level. When we turn to the scientific literature, the question is not whether food can cure fatty liver disease, but whether dietary changes can reduce liver fat and improve liver function. On this point, the evidence is increasingly consistent. Clinical studies suggest that changes in diet can lead to measurable reductions in liver fat, improvements in liver enzyme levels, and better metabolic markers. Imaging studies using ultrasound and MRI have shown reductions in liver fat following dietary interventions. Blood tests often show improvements in markers of liver stress when dietary quality improves. These changes do not happen overnight, and they are not universal in every individual, but the overall pattern in the research is clear. Diet can meaningfully influence the course of fatty liver disease. Rather than focusing on single foods, most high-quality studies examine overall dietary patterns: whole, food, plant-based or plant-forward eating patterns have been studied extensively for their effects on metabolic health. These diets tend to be naturally high in fiber and low in refined sugars and saturated fats, Research consistently shows that higher fiber intake is associated with improved insulin sensitivity and reduced liver fat. Fiber slows the absorption of sugars, improves gut health, and helps regulate appetite, all of which reduce the metabolic burden on the liver. Diets that reduce fructose intake, particularly from sugar, sweetened beverages, show notable benefits in reducing liver fat accumulation. Mediterranean-style dietary patterns which emphasize vegetables, fruits, whole grains, legumes, nuts, and healthy fats have also been associated with improvements in fatty liver markers. These patterns are not defined by strict rules, but by overall balance and food quality. Evidence indicates that reducing ultra-processed foods, regardless of whether one follows a strictly plant-based or mixed diet, is associated with improvements in liver health. What these patterns have in common is a reduction in metabolic stress on the liver and improved insulin signaling. Certain groups of foods appear repeatedly in studies examining liver health, not as cures, but as protective factors. Fiber-rich foods are associated with better blood sugar control and reduced liver fat accumulation. Antioxidant-rich plant foods are linked to lower levels of inflammation and oxidative stress, both of which play a role in liver injury. Healthy fats, particularly those found in whole plant foods, nuts, seeds, and some oils, are associated with improved lipid metabolism. These foods appear to support the liver's ability to process fats more efficiently. Importantly, studies describe these associations as improvements, not guarantees. The benefits are part of an overall pattern rather than the result of any single food. Weight loss is often discussed in relation to fatty liver disease, and for good reason. Research shows that weight loss can significantly reduce liver fat. Even modest weight loss is associated with improvements in liver enzyme levels and imaging findings. However, evidence also indicates that diet quality matters independently of weight loss. Some studies have shown reductions in liver fat even in the absence of dramatic weight loss, suggesting that metabolic improvements can occur before the scale changes significantly. This distinction is important because it shifts the focus from short-term weight goals to long-term metabolic health. Food quality influences insulin sensitivity, inflammation, and fat metabolism regardless of weight. When insulin resistance improves, the liver produces less fat and becomes better at breaking down existing fat. This metabolic shift helps explain why dietary changes can improve liver health even without rapid weight loss. It also highlights why extreme dieting is not necessary and may even be counterproductive. Sustainable dietary changes are more likely to produce lasting metabolic benefits. It is also important to be clear about what food cannot do alone. Advanced stages of fatty liver disease, such as significant fibrosis or cirrhosis, require medical evaluation and management. While dietary changes can support liver health at all stages, they do not replace medical care, medications, or monitoring when liver damage is advanced. Evidence-based nutrition should be viewed as a supportive strategy, not a substitute for professional treatment. This distinction is critical for maintaining trust and safety in health communication. For individuals in earlier stages of fatty liver disease, practical, study-inspired dietary shifts can be both effective and achievable. Reducing added sugars, especially from sweetened beverages, is one of the most consistently supported strategies. Limiting refined carbohydrates and ultra-processed foods reduces insulin spikes and metabolic stress. Increasing the intake of whole plant foods, such as vegetables, fruits, legumes, and whole grains, gradually and sustainably supports liver health through improved fiber intake and nutrient density. Alcohol reduction or avoidance is also important, even in non alcoholic fatty liver disease, as alcohol adds additional stress to the liver. Consistency matters more than extremes. Research consistently shows that long-term dietary patterns have a greater impact on liver health than short-term interventions. Small, sustained changes accumulate over time and produce measurable improvements in metabolic markers. Viewing food as a daily signal to the liver, rather than a short-term fix, aligns closely with what the evidence suggests. When we step back and look at the totality of the research, a clear picture emerges. The evidence does not suggest magic foods or guaranteed reversals. What it does show is that dietary patterns strongly influence liver fat, inflammation, and metabolic health. Food is not just a source of calories, it is a set of biological signals that shape how the liver functions day after day. Early action, guided by evidence-based choices, can meaningfully change the trajectory of fatty liver disease. The liver is remarkably resilient, especially when harmful inputs are reduced and supportive conditions are restored. Research consistently shows that what we eat every day plays a central role in that process. Rather than fear or false hope, the science offers something far more valuable: informed empowerment. By understanding what studies show and applying that knowledge thoughtfully, food can become part of a long-term strategy to support liver health and overall metabolic well-being. Fatty liver disease has become one of the most common chronic liver conditions worldwide, yet what makes it particularly concerning is that it often develops silently. Millions of people may be living with excess fat accumulating in their liver cells without ever noticing any symptoms. This lack of obvious signs is why fatty liver disease is sometimes referred to as a silent epidemic. Many individuals may feel generally healthy, have normal energy levels, and remain unaware that their liver is under stress until routine blood tests, imaging studies, or more advanced complications reveal the underlying problem. The silent nature of the disease means that it can progress quietly for years, and in some cases, decades, before people even realize something is wrong. By the time symptoms such as fatigue, mild abdominal discomfort, or general malaise appear, the liver may already be experiencing inflammation or early signs of damage. Among the two main types of fatty liver disease, non-alcoholic fatty liver disease, or NAFLD, has emerged as the more prevalent and concerning form in modern societies. Unlike alcoholic fatty liver disease, which is directly linked to excessive alcohol consumption, NAFLD occurs in individuals who drink little or no alcohol. Its development is strongly influenced by contemporary lifestyle and dietary patterns. The primary driver behind NAFLD is insulin resistance, a condition in which the body's cells become less responsive to insulin, the hormone responsible for regulating blood sugar levels. When cells do not respond properly to insulin, glucose remains in the bloodstream, prompting the liver to convert the excess sugar into fat. Over time, this fat accumulates in liver cells, creating the foundation for fatty liver disease. Modern diets exacerbate this process. The overconsumption of refined carbohydrates, such as white bread, pastries, and sugary cereals, leads to sharp spikes in blood sugar, which in turn contributes to insulin resistance. Added sugars, particularly in the form of fructose found in sweetened beverages, processed snacks, and desserts, place a unique metabolic burden on the liver. Unlike glucose, which is used throughout the body, fructose is almost entirely processed by the liver, where it can be converted into fat and contribute to hepatic steatosis. In addition to sugar, high intake of saturated fats, trans fats, and ultra-processed foods further stresses the liver, promoting fat accumulation and inflammation. Sedentary lifestyle patterns play a critical complementary role in the development of NAFLD. Physical inactivity reduces the body's ability to regulate blood sugar effectively and impairs the muscle's ability to take up glucose, placing additional pressure on the liver to metabolize and store excess sugar as fat. Obesity, especially excess abdominal fat, compounds this problem by releasing inflammatory molecules and free fatty acids into the bloodstream, which are transported directly to the liver. The combination of insulin resistance, poor diet, and low physical activity makes fatty liver disease an increasingly common condition in modern societies. Yet, despite its prevalence, most people remain unaware of the condition until screening tests or related metabolic complications occur. Understanding that NAFLD is closely tied to diet and lifestyle is critical because it highlights that early recognition and modification of these factors can significantly impact liver health. Awareness is the first step. By acknowledging that fatty liver is common, silent, and strongly linked to the modern diet, individuals can begin to make informed decisions to protect and support their liver before serious damage occurs. Research indicates that diet plays a powerful and measurable role in reducing liver fat, and this effect is supported by a growing body of clinical studies. It is important to emphasize that dietary interventions do not constitute a miracle cure for fatty liver disease. Rather, the changes they bring about are gradual, evidence-based, and scientifically measurable. By focusing on dietary quality and nutrient-dense foods, individuals can significantly improve liver health over time. Unlike medications, which are often limited to managing symptoms or treating complications, diet addresses one of the root causes of non-alcoholic fatty liver disease, namely, excess fat accumulation in liver cells driven by insulin resistance, overnutrition, and metabolic imbalance. Clinical studies consistently suggest that structured dietary improvements are associated with reductions in liver fat, as observed through advanced imaging techniques such as ultrasound, magnetic resonance imaging (MRI), and magnetic resonance spectroscopy. These imaging studies provide objective evidence of changes in liver fat content over weeks and months, confirming that dietary modifications can produce real, measurable results. In many trials, participants who adopted whole food, plant-based or Mediterranean-style diets experienced a significant decrease in hepatic fat without relying on pharmacological treatments. In addition to imaging improvements, blood markers commonly used to assess liver function, such as alanine aminotransferase ALT and aspartate aminotransferase AST, often show measurable reductions, indicating reduced liver stress and inflammation. Importantly, these benefits are not limited to individuals who achieve rapid or extreme weight loss. Evidence shows that liver fat reduction can occur even in the absence of dramatic weight changes, as long as dietary quality improves. This distinction underscores the concept that it is not only the quantity of calories consumed, but also the quality of the food that determines liver health. Diets rich in whole plant foods, high in fiber, and low in added sugars and refined carbohydrates improve insulin sensitivity, regulate blood sugar levels, and reduce the metabolic burden on the liver. These changes, in turn, support the liver's natural ability to metabolize and break down stored fat, leading to gradual reductions in liver fat accumulation. Several clinical trials highlight the power of dietary patterns rather than isolated foods. For instance, participants adhering to a high-fiber, plant-forward diet showed measurable reductions in hepatic fat after several weeks, alongside improvements in systemic inflammation and lipid profiles. Similarly, Mediterranean-style diets emphasizing vegetables, fruits, legumes, whole grains, and healthy fats have been repeatedly associated with improvements in liver fat content, insulin sensitivity, and liver enzyme levels. These findings demonstrate that sustainable dietary patterns, rather than short-term fad diets, drive meaningful improvements in liver health. Overall, the evidence emphasizes that while food alone is not a magical cure, it is a powerful tool for reducing liver fat and supporting liver function. Early-stage interventions through diet can prevent progression to more serious liver disease, including fibrosis and cirrhosis, and reduce the risk of associated metabolic disorders such as type 2 diabetes and cardiovascular disease. By following evidence-based dietary approaches, individuals can achieve measurable improvements in liver fat, biochemical markers, and overall metabolic health, without medications in many early cases, showing that what we eat every day has a profound impact on our liver's ability to function optimally. When it comes to supporting liver health, research consistently emphasizes that overall dietary patterns matter far more than individual superfoods or isolated nutrients. While the media often highlights specific foods as miraculous for liver health, clinical evidence shows that it is the cumulative effect of an entire eating pattern that produces meaningful and sustainable improvements. The liver responds to consistent dietary inputs over time, and it is the quality, diversity, and balance of foods consumed on a regular basis that influences liver fat accumulation, inflammation, and overall metabolic function. This perspective shifts the focus from searching for single magic foods to adopting a holistic approach that emphasizes whole, minimally processed, nutrient-dense foods. Evidence consistently shows that whole, food, plant-forward diets are particularly effective in supporting liver health. Such diets are naturally high in dietary fiber, which plays a crucial role in regulating blood sugar, improving insulin sensitivity, and reducing the metabolic burden on the liver. Fiber slows the absorption of sugars, reduces post-meal glucose spikes, and promotes a healthy gut microbiome, all of which are factors closely linked to fatty liver disease. A fiber-rich diet also helps reduce overall caloric density, supporting weight management, which further alleviates stress on the liver. Plant-forward diets prioritize vegetables, fruits, legumes, whole grains, nuts, and seeds, creating a nutrient-dense eating pattern that provides essential vitamins, minerals, antioxidants, and phytonutrients. These compounds help counter oxidative stress and inflammation, which are key contributors to liver injury and fatty liver disease. Mediterranean-style diets, which combine high consumption of plant foods with healthy fats from olive oil, nuts, and fatty fish, have also been shown to benefit liver health in numerous studies. This eating pattern emphasizes minimally processed foods, reduces intake of refined carbohydrates and added sugars, and includes anti-inflammatory fats. Clinical trials indicate that adherence to Mediterranean-style diets improves liver enzyme levels, reduces hepatic fat content, and enhances overall metabolic markers such as insulin sensitivity and lipid profiles. The key takeaway from these studies is not that one single food is responsible for these improvements, but that consistent adherence to a high-quality, balanced dietary pattern produces measurable benefits over time. Ultra-processed foods, including sugary beverages, packaged snacks, refined baked goods, and processed meats, consistently correlate with higher liver fat accumulation and increased risk of metabolic disease. Evidence indicates that diets high in added sugars and processed foods contribute directly to insulin resistance, chronic inflammation, and fat deposition in liver cells. By contrast, eating patterns that limit these foods while prioritizing whole, plant-based options support the liver's natural detoxification processes and fat metabolism, creating a protective environment against fatty liver progression. In practical terms, focusing on overall dietary patterns means adopting consistent habits rather than relying on occasional superfood consumption. It encourages sustainable changes that people can maintain long-term rather than short-term diets or fads that produce minimal or temporary effects. The evidence shows that it is the accumulation of small daily dietary choices, choosing whole grains instead of refined grains, vegetables instead of processed snacks, legumes instead of fatty meats, that ultimately drives meaningful improvements in liver health and metabolic function. In essence, the liver responds best to consistency, quality, and diversity in diet, making the adoption of balanced, plant-forward, or Mediterranean-style eating patterns one of the most effective strategies for long-term liver support. When it comes to improving liver health, food quality plays a critical role that goes beyond simply losing weight. While weight loss is often emphasized in discussions about fatty liver disease, emerging research consistently shows that the type and quality of foods consumed can improve liver fat content and metabolic health, even before significant changes on the scale occur. This distinction is important because it highlights that liver fat reduction is not solely dependent on weight loss. Rather, it is profoundly influenced by what we eat and how our diet affects insulin sensitivity, inflammation, and fat metabolism. In other words, dietary quality itself can act as a therapeutic tool independent of body weight. Several clinical studies have demonstrated that participants who adopt high-quality, nutrient-dense diets experience measurable reductions in liver fat without undergoing dramatic weight loss. For example, plant-based or plant-forward diets, rich in vegetables, fruits, legumes, whole grains, and healthy fats, have been shown to improve liver enzyme levels and reduce hepatic fat even when body weight remains relatively stable. These dietary patterns enhance insulin sensitivity, allowing the liver to more effectively process glucose and fat, which directly reduces fat accumulation within liver cells. By improving the body's metabolic efficiency, high-quality diets help the liver function optimally, highlighting that fat reduction in the liver is not solely a matter of caloric restriction. Improved insulin sensitivity is one of the key mechanisms by which diet quality supports liver health independently of weight loss. Diets high in fiber and low in added sugars, refined carbohydrates, and ultra-processed foods reduce the spikes in blood glucose and insulin that otherwise promote fat storage in the liver. Fiber, in particular, slows carbohydrate absorption, modulates the gut microbiome, and enhances satiety, which together reduce metabolic stress on the liver. Clinical evidence shows that even modest improvements in diet quality, such as replacing sugary beverages with water, incorporating more vegetables and legumes, and choosing whole grains over refined options, can significantly lower liver fat and reduce inflammatory markers, even before substantial weight loss occurs. Moreover, the focus on food quality encourages sustainable lifestyle changes rather than short-term extreme measures. While rapid weight loss can sometimes reduce liver fat temporarily, it is often difficult to maintain, and extreme caloric restriction may create metabolic stress. In contrast, adopting a high-quality, nutrient-rich diet produces consistent improvements over time, reducing hepatic fat, lowering oxidative stress, and improving overall metabolic function. These benefits are cumulative, meaning that consistent adherence to healthy dietary patterns produces stronger and longer-lasting improvements than occasional dieting or temporary weight loss efforts. In essence, the scientific evidence underscores a crucial point. Liver health is not just about the number on the scale. Even without significant weight loss, high-quality dietary changes can lead to measurable improvements in liver fat content, liver enzyme function, and insulin sensitivity. This insight shifts the focus from short-term dieting to long-term dietary strategy, emphasizing that what we eat every day directly influences liver health. By prioritizing nutrient-dense, minimally processed foods and reducing metabolic stress, individuals can support liver function, reduce fat accumulation, and improve overall health, even before the scale moves. Food, in this context, becomes both a preventive and therapeutic tool, offering a tangible way to manage fatty liver disease through evidence-based, sustainable choices. While diet plays a critical role in supporting liver health and reversing early stages of fatty liver disease, it is essential to recognize its limitations, especially in advanced disease. Food can be a powerful tool to reduce liver fat, improve metabolic markers, and lower inflammation, but it is not a replacement for professional medical care when liver damage has progressed beyond certain stages. In conditions such as advanced fibrosis or cirrhosis, structural changes in the liver have already occurred. Scar tissue replaces healthy liver cells, reducing the organ's ability to function properly. At this stage, dietary modifications alone cannot restore lost liver tissue, and medical intervention becomes essential. Understanding this distinction is crucial for anyone managing liver disease, as it ensures that individuals take both preventive and therapeutic steps appropriately. Studies consistently show that dietary changes are most effective in early or moderate stages of non-alcoholic fatty liver disease. When the liver is still relatively healthy and has the capacity to regenerate, reducing fat accumulation, improving insulin sensitivity, and lowering inflammation through diet can significantly slow or even partially reverse disease progression. Nutrient-dense whole food, plant-forward diets, Mediterranean-style patterns, and reductions in added sugars, refined carbohydrates, and ultra-processed foods all contribute to liver support at these stages. These changes can improve blood markers, liver enzyme levels, and imaging results, reflecting a healthier metabolic environment that allows the liver to function more efficiently. However, when fibrosis or cirrhosis is already present, structural liver damage limits the organ's ability to respond fully to nutritional interventions. Medical supervision becomes critical in advanced liver disease for several reasons. First, patients with significant fibrosis or cirrhosis are at increased risk of complications such as portal hypertension, fluid retention, bleeding, infections, and liver failure. These complications require careful monitoring, diagnostic testing, and, in some cases, medications or procedures that cannot be replaced by dietary changes alone. Second, advanced disease often involves metabolic and systemic changes that can exacerbate liver stress, including altered protein metabolism, fat absorption issues, and hormonal imbalances. Professional medical care ensures that these factors are managed safely, while diet remains an important supportive component. Nutrition continues to play a vital complementary role even in advanced liver disease. Evidence suggests that appropriate dietary interventions can reduce further fat accumulation, support overall metabolic health, and help maintain energy balance. A focus on nutrient-rich foods, adequate protein from high-quality plant or lean sources, and careful management of salt, sugar, and fat intake can improve quality of life and support ongoing liver function. Importantly, these interventions are not curative at this stage, but act synergistically with medical treatment to optimize outcomes. The key takeaway is that food should be viewed as a strategic, evidence-based ally for liver health, not a standalone solution in severe disease. Early detection and intervention are paramount, as they allow dietary improvements to have the greatest impact. Once liver damage has progressed to fibrosis or cirrhosis, professional care becomes essential, and nutrition should complement rather than replace these treatments. By understanding the limits and strengths of dietary intervention, individuals can make informed choices, engage with healthcare professionals appropriately, and use nutrition as a powerful tool to support liver healing and overall metabolic health, while respecting the critical role of medical management in advanced disease.